Hello, my name's Sarah Rossetti. I'm an associate professor of biomedical informatics and nursing at Columbia University Irving Medical Center. And today I'll be presenting on the Concern Early Warning System, an AI-driven real-time early warning for patient deterioration in the hospital setting. I'd like to acknowledge our team and research funding for this work, funding from the National Institute of Nursing Research at the National Institute of Health, as well as from the American Nurses Foundation Reimagining Nursing Initiative, and our team from several different sites: Columbia University, Brigham and Women's Hospital, Mass General Brigham, University of Colorado, Washington University in St. Louis, Vanderbilt University, and University of Pennsylvania. So what is Concern? Concern is an early warning system for patient deterioration. It uses signals gained from nursing documentation patterns. These signals are actually a type of nursing practice that nurses have, in our data, been shown to consistently perform, called nursing surveillance. Nursing surveillance is a part of nursing practice that increases with increased nursing concern. Nurses attend to patients more frequently, they assess patients more frequently, they follow up on information and data points that appear to be concerning or changes that may be occurring to a patient's condition to assess whether or not a patient is in fact deteriorating and if additional interventions need to be escalated. So Concern then uses a multinomial gradient boosted machine learning model to detect these nursing surveillance documentation pattern changes and generates a deterioration score for display in real time. It detects these nursing surveillance documentation pattern changes because when nurses actually change their behavior and they assess a patient more frequently or at times that they normally wouldn't, they might be collecting data as part of the nursing surveillance process. They also document and record this information. And so that's actually the information that our machine learning model uses from the patient record. We then use what's called an ensemble modeling approach for modeling this risk for deterioration in acute care units as well as intensive care units, and have been shown to have prediction accuracy of over 97% in both settings. You see the screenshots here of the Concern Early Warning System of what clinicians, both nurses as well as physicians and nurse practitioners and physician assistants, see on their screen for patients who they're caring for in the hospital. They see a red, yellow, or green score within their patient list for every patient. And if that score has changed in the past hour, there's an asterisk there to indicate that the score has changed. Now, red indicates that a patient is already deteriorating. Yellow indicates that a patient is at increased risk for deterioration, and green indicates a low risk for deterioration. And in our work developing this with nurses as well as other types of clinicians, we've really identified that red are the patients that the care team is likely already aware of, but yellow are the patients that Concern is really trying to intervene on, the patients that the care team might not yet be aware are deteriorating, but are at an increased risk for deterioration. And we'll talk a bit more about how the model works and how it's an early identifier of increased risk for deterioration. You then see the screenshot of the Concern Smart app, and this is a detailed screen of the actual features that are driving the prediction. And this allows the clinician to really enhance their trust of the system and the interpretability of the prediction, where they can actually go in and see what data was actually being used in the model to drive the prediction. They can see the patient's vital signs, for example, if those were a driving factor in the prediction, or other assessment data or notes that may have been documented. This screen also provides a trend line of the patient's risk for deterioration over the past 72 hours, as well as where this patient is relative to other patients on the clinical unit. So how does Concern really work? Well, it takes signals from nursing documentation patterns. So it detects really increases in nursing surveillance when a nurse is recording vital signs more often, or when a nurse might be recording those vital signs at uncommon times. It's very common for a nurse to record vital signs on any given morning in the hospital around 9 a.m. But it's less common on certain units where patients are expected to sleep through the night for the nurse to be recording vital signs at 3 a.m. And so if a nurse is recording vital signs at 3 a.m., that may be an indicator that there's something concerning about the patient's state that warrants the nurse to record that extra set of vital signs. And it's not just an extra set of vital signs that is a predictor in our model, though that is one type of feature, but many other types of features as well that really reflect when a nurse has increased assessment for a patient and is escalating nursing interventions and subsequently may escalate other interventions in coordination with the care team. So we look for these changes in nursing documentation patterns, and we use our machine learning based model and display these scores in real time. We evaluated the model in a multi-site pragmatic cluster randomized controlled clinical trial. It was a 1-year clinical trial. It took place at 2 different health systems, and so that was over the course of 2 different years, but in total at each health system it was 1 year. Within the 2 health systems, each health system had 2 hospitals. And so there were a total of 4 hospitals in the trial, an academic medical center at each site, as well as a community hospital at each site. And so from these 4 hospitals, there were 74 clinical units that were part of the trial. And those clinical units were randomized. So we had 37 units which were within the concern intervention group and 37 units which were within the usual care group. And usual care is exactly as it sounds, that there was no early warning system in place and that the usual care and protocols were followed when a nurse or other clinician identified that a patient was at risk. In our concern intervention, we're very clear that there's the risk identified by the concern system, and then the next steps are for the clinicians to follow their current institutional protocols for communication of that risk and escalation of care, which really is to increase the care team's situational awareness of the patient's risk, and then follow institutional protocols as they apply for a patient that's deemed at increased risk. And so within this trial, we had just over 60,000 patients. And what we showed was that patients in the concern intervention group, so those whose clinicians received the concern early warning system, had a 35.6% decreased risk of in-hospital mortality, over half a day decreased length of stay, a 7.5% decreased risk of sepsis, and a 24.9% increased risk of unanticipated transfer to the ICU. And we actually performed several sub-analyses for these patients who were transferred to the ICU. And our analyses indicated that these were earlier transfers that were occurring for these patients. And those patients went on to have decreased in-hospital mortality, length of stay, and decreased sepsis. Now, how is it that we were able to observe those outcomes? Well, the concern early warning system, our data actually shows, identifies patients' risk almost 2 days earlier than other early warning systems that are based on vital signs or other physiological data. And so it does this because it's really looking at the nursing behaviors and documentation patterns. And nurses are really expert at identifying subtle indicators of risk for deterioration and subtle indicators of changes in patient state. And so we use the electronic health record data that reflects the behaviors nurses engage in when they identify those subtle changes in a patient's condition. And the behaviors that nurses engage in and subsequently document are activities such as increased entry of vital signs, increased frequency of those entries, increased documentation of free text comments associated with vital signs in the flow sheets, changes in documentation around medication administration record. There may be increased frequency of certain PRN medications, so medications that are given as needed, or certain scheduled medications may be withheld. So for example, if a patient typically receives a blood pressure medication, we've observed in our data that sometimes if the nurse is not giving that medication, it may be because the patient's blood pressure is actually perhaps borderline or lower than normal. And while it's still may be normal within a normal physiological range, the nurse observes that it's not normal for that patient and that extra assessment and attention may be needed, and they're questioning whether the patient should be getting this blood pressure medication at that point in time. So the nurse is engaging in nursing surveillance to really follow up and identify if there's a concern and a potential deteriorating state that's beginning for that patient. We also observe in our model if there's increased frequency in nursing note documentation. And then we use NLP as well, natural language processing, to look at some of the content of nurses' notes for some particular phrases that are consistent with patient deterioration, such as we found the phrase MD aware is very common in nursing notes and can indicate that the nurse is concerned about a changing patient state. We also use what's called continuous time-dependent scaling. So time is extremely important in our model. There are overall patterns of nursing documentation for a hospitalized patient's first day in the hospital, and a hospitalized patient's second day in the hospital, and a hospitalized patient's third day in the hospital. So we've observed in looking at many thousands of patients' charts using our machine learning model that these are very consistent patterns in terms of how frequently certain elements and when certain data elements are documented on day 1 and on day 2 and on day 3. There's also a lot of commonality around times of day of when nurses record certain information. There's also commonality among seasons of changes and variation among seasons of when and how things occur in the hospital. And so using these common patterns, we're able to detect when something's occurring at an uncommon time or at an increased frequency. We also include other categorical features in the model, such as patient demographics, where the patient is within the hospital, the type of unit that they're on, as well as time since last ICU visit, for example. And then this generates a score, which we then convert into and transform into a red, yellow, or green icon for easy display to clinicians. In our concern study, in our funded research, we really went through extensive user-centered design and simulation studies with nurses and prescribing providers. So this slide is intended to show the very early designs on the lower left-hand part of the screen that we were working through closely with clinicians to understand what is the data that you need in order to, one, understand how the concern algorithm works and what the predictive output means, and also so that you can trust it and actually utilize it in your patient care. So we really had to work through not only what's the number scale, is it 0 to 10, is it up to 20? Well, what we landed on was it's a 3-point scale, and that converted to a red, yellow, or green icon. And then what's the other information that needs to be conveyed as well? And what we landed on is that this should not be an interruptive alert, that the best place for it is the patient list, and that the red, yellow, green really conveys the key information that is needed immediately for the clinician to understand what's going on with the patient, as well as including this asterisk that indicates if the score changed in the past hour. And that change of patient state is really key information to help the patient prioritize which patients to pay most attention to. Here's a more detailed screenshot of the app that we developed, and this uses the FHIR interoperability standard to integrate with any electronic health record. And this provides the details about the actual data that was driving the feature and the prediction for that patient. And again, this was developed so that we could really enhance interpretability and trust among clinicians in using this model. We've been working on scaling and spreading the Concern early warning system via our funding from the American Nurses Foundation Reimagining Nursing Initiative. And so we do have a toolkit posted for hospitals that are interested to access resources that can guide them along the path for implementation and engage with us in a case-by-case basis in an academic research license. And we have developed our software to be within a Docker architecture to make it easier to implement for hospital analysts. To point out some of our references from our study, and thank you very much for your time.